Jasmine, you're ready. Let's just see how this goes for our first try. Hello, my name is Sabrina. I'm a nursing student. I'm here, so I was told we needed some blood today, okay? I checked my order for that. Can I have you give me your name and date of birth? So she's going to tell me her name and date of birth, and she says it's Betty Jones, and gives me her date of birth. I'm going to go ahead and check that here. Betty Jones, we have date of birth 5/18/1996, so that matches my order more. Perfect, dear. So I did see here that we already had the consent form signed by you and the doctor, stating that you're okay with getting some blood product today. So what that involves is we're going to go ahead and give through this IV some blood. So you could have a reaction. I know this was discussed with the doctor, but some things you might have, and I want you to notify me right away, is going to be a shortness of breath, chest pain, back pain, any itching. If you start to feel hot, really anything unusual, I really want you to tell me right away. Okay. Betty, do you understand that? At this time she says she understands. Okay, Betty, I am going to go ahead and get some things prepared before we get started. So I gathered a few supplies before coming in the room. I had just grabbed my tubing for this, and I had grabbed normal saline already. And then I have some flushes and alcohol. So I'm going to start by flushing your IV site to make sure it's patent. So looking at your arm, your skin looks intact. I have no redness or swelling or irritation, so that looks good. Betty, do you have any allergies? Betty says she doesn't have any allergies. I just want to check that against the MAR here. I don't see any allergies, so that is good. All right, let's go ahead, my dear. Let's get your IV flushed and make sure it's nice and patent. I do see she has a 20 gauge. For this, we would want an 18 to 20 gauge needle to be receiving blood product. Prime my wonderful saline flush here. So per agency protocol, I probably watch this 15 to 30 seconds based on our agency. And then I would flush based on also the agency protocol. For this, I'm going to go ahead and I'm going to give about 6 mL.
And then I would continue with the vital signs from the agency protocol for the time that it is receiving. Okay, so I'm going to...
That is flushing wonderfully, Betty. Do you have any pain or discomfort with that? Betty says, no, there's no pain or discomfort. That is good, Betty. Okay, I'm going to go ahead. I'm going to check your vitals then quickly. So I would take her vital signs. I would then assess her lungs as well so I can document all of that as well. As of right now, her vital signs are great and her lungs sound wonderful. All right, Betty, I'm going to go ahead. I'm going to just prime my normal saline here. So getting the normal saline, I would check to make sure that's safe to give with a blood product, and it is. I would check my bag, make sure there's nothing floating in it. I would check the expiration date on here, which it is not going to expire, so that is good. It means it's a good bag to use. I'm going to go ahead and hang this up here for a moment. Okay, and then for my tubing, we will unknot this first. All that fun stuff with tubing. I'm going to make sure all my clamps are clamped. Oh my.
And then I would program my pump to infuse about 50 more milliliters because 50 milliliters should be enough to clear the blood out of the lung. And then I'll make sure that the patient is safe and comfortable and that she's got her call light.
Okay. Betty, do you have any questions at this moment? Betty says no, she has no questions.
Time the infusion began and ended.
first I'm gonna spike the normal saline.
Tolerated it, if there was any transfusion reaction, and what I did about it if there was. I document the amount of blood infused, the type of blood infused, the unit number, and
Okay. I'm gonna go ahead and I'm gonna prune the line, so I'm gonna let it all run through here. So I will unclamp the normal saline line at this time.
Assessment of the IV site and the size and type of the needle, and the caps are used.
Try to get out all those bubbles. Looks good. I'll make sure that this fluid is all the way up to my filter.
Woo! I could bring myself at the end.
I think you did good.
There we go. So it's covering the filter. I'm gonna go ahead. I'm gonna clamp my normal saline at this time. Okay, I'm gonna go ahead. We're gonna just hang this right now up and over the pump while we wait to get the blood product. Okay, so I'm gonna call to my other nurse and let her go grab me that blood product. So I have that. So once I get the blood product, I have 30 minutes to get that bag hanging, and then I have 4 hours to transfuse the blood. So my nurse has come. She has brought me the blood product I need. So we're gonna go ahead. We're gonna do some checks here, buddy, quickly to make sure I have the correct order, okay? So let's take a quick peek here.
I explained.
So the nurse would stay with me to do these checks, okay? But for today's purposes, I'm going to do the checks by myself as 2 people. Okay, so this is the blood product the nurse brought me here. Okay, so let's take a quick peek here, Betty. Can you give me your name and date of birth one more time? She says Betty Jones. Date of birth is 5/18/1996. Perfect. So that matches Betty Jones here, Betty Jones here. So I have a medical record number of 224466. Medical record number of 224466. The location is HLRL. Location is HLRL. Account number 123456. Account number of 123456. So my red armband is 456654. My red armband is 456654. Let's double check here. 456654. Still matching. We have the patient blood type being B positive, which matches B positive here. The donor pool number is 7890. Donor pool number is 7890. I have 4 units in this pool. 4 units in this pool. There's 250 mLs in this bag. 250 mLs in this bag. My blood product is packed red blood cells. Blood product is packed red blood cells with an expiration date of 6/21/22 at 1500. Expiration date of 6/21/22 1500. My donor blood type is O positive. My donor blood type is O positive. Compatibility test is completed. Compatibility test is completed. Today's date is 1/21/22. Today's date is 1/21/22. All right, so that all seems to check out, and we did have the signature from you earlier and the doctor's consent already signed on our form. Any questions, Betty? No, Betty does not have any questions at this time. Okay, Betty, so we're going to take a look at this bag also before we get started. I want to make sure there's no blood clots formed in here. I want to make sure there's no floaters going in here. It's a normal color, and it all looks good. And just set these right next to you, Betty, so I have them, okay? So everything should still be clamped at this moment. So now I'm going to go ahead and I am going to spike my blood cells. Okay. And because I want to make sure that Betty gets the red blood cells first, I'm going to prime the line so the blood is right at the end. This way, when I stay in here for the first 15 minutes just watching her, checking for any reactions, she's going to be getting that blood and not the normal saline. So we're going to go ahead and we're going to open. So I have the normal saline is still clamped. I'm going to unclamp my blood product. I'm going to open my roller. Get the blood to the end here. And I can see that everything is now turned pink. So the blood is now at the end. This time I'll be able to hook Betty up. I reclamped my roller so she is not getting any product at this moment. Again, I'm going to wash the end of the tubing here per protocol, so 15 to 30 seconds to prevent any infection. Perfect, we got you hooked up there, Betty. Now I'm going to go ahead and get the pump set up. Again, my normal saline is clamped. My blood cells are what are open. Turning on our pump. She's tired. Okay. So we're going to enter our patient's information here. Patient, yes. Insert, yes. Okay, we're going to enter my patient's medical number. Perfect. So I'm going to select a channel here. We're going to do the guardrail IV fluids. I'm going to go down and find blood in here. All right, so now we will check our order just one more time to make sure we enter everything correctly. So we're going to do blood, as it says. Blood, yes. So we're going to start for the first 15 minutes. For Shirley, we'll be going at 50 mLs per hour. That's going to be watching for any reactions. And then I will do my vital signs again at 15 minutes. I will come back at 30 minutes. I will do vital signs again at that time. And then per the agency protocol, it's standardly usually about 1 hour checks for that 4-hour time window you have. If she is tolerating well after that first half an hour, you can turn up your pump if you would like to. All right, so we are going to enter select channel. I waited too long. Blood. We got blood, if this is correct. So my rate is going to be 50 mLs per hour. And my volume to be infused. So I have 250 mLs in my bag. I don't want it to run dry, so I am going to do only 200 mLs to start. Okay, that checks correct with my order. I have my blood open. I'm going to open my roller clamp. And I have my line open there so we can start our blood. Ensure everything is going fine. Check my drip chamber. We are dripping. Betty, do you have any pain or discomfort at this moment? Betty says she does not have any pain or discomfort. Okay, I'm going to wash my hands here quickly, Betty, and clean up a little bit. I'm going to be hanging out with you, like I said, for 15 minutes, okay? I did bring in a computer here at the end of the room. I'm going to be documenting while I'm hanging out with you, I want you to tell me if you're feeling anything different. Like we said, that chest pain, shortness of breath, back pain, itchy, hot, any of that I would like to be aware. If you were to have a transfusion reaction, the first thing I'm going to do is I'm going to come over here. I'm going to immediately stop your pump. I'm then going to get some normal saline, new tubing. We're going to hook you up to all of that, and we are going to flush out the blood. So I would take the blood product and the tubing you are currently hooked up to, that's going to go in a biohazard bag and be sent back to the lab. Once I have you hooked up to that normal saline, I'm going to be contacting your provider and the lab, okay? And we would go from there. Any questions about that, Betty? Betty says no, she has no questions. All right, Betty, I'm going to go ahead, I'm going to document. So I'm going to document, I want to put in there that she has a 20 gauge in her left forearm, that the site was looking, no abnormalities. I'm going to put the start time of when I started my blood transfusion. When we were done, I would of course put the stop time of the transfusion. I'm going to put in here, I'm going to have all of this information, so the MedRec number, her red armband, B positive, the donor pool, units, volume given, packed red blood cells, O positive. All of that information will be in my documenting, how she tolerated it, all of that. Okay, so when we were done, excuse me, I would then, when we were done, I would close my clamp on the red blood cells, opening the clamp on the sodium chloride, switching my pump to sodium chloride, and flushing with 50 mLs. So then I would know that things are complete, chucking everything in the biohazard bag. Any questions, Betty? Betty has no questions. I am going to wash my hands, give her call light, and you call if you need anything, Betty. She says, okay. And that is how I would administer blood.